Why the Lumbopelvic Rhythm Test is an incredible tool to map out and determine how certain injury or certain reoccurring injury of the lumbar spine, pelvis, and the muscle attaching to those two structures have come about. First of all, the Lumbopelvic Rhythm Test is a test to determine when the pelvis start moving during trunk flexion. Okay, pelvis should start moving at 50 degrees of trunk flexion. And the reason why we want to see that balance movement at that 50 degrees is because then it will show us the forces that are traveling through those structures, the lumbar spine, the pelvis, and the muscle that are attaching to that are balanced, okay? So no one structure, no one tissue is under excessive load, and consequently more wear and tear. There are two issues, obviously. There is a pelvis that is moving straight away, how soon we start flexing forward, and a pelvis that moves very late, past the 50 degrees. There is a common issue with both of these two, with both of them. The common issue is weakness in the lower abdominal and weakness in the so-called inner unit or core muscle. Those are deep abdominal muscles. Both of them, the lower abdominal and the inner unit, which is a group of muscle together, working together, create stability at the pelvis and the lumbar spine. And what that stability does is that help to create a stable structure so that there are no external muscle working over time or tissue that are being put under excessive stress. So the first one is when the pelvis is moving too early, okay? Most likely, this is driven by a very active lumbar extensor. The lumbar is attached to the top of the pelvis and they go into the spine. So you imagine if I have this muscle very tight, how soon I start moving my trunk, my pelvis is coming with it. Most of the time, the people that have this issue, they also may had likely a back injury already in the past. And they have learned to guard their back by tightening, either consciously or unconsciously, those muscles, okay? And the problem with that is that tightness also create an anterior pelvic tilt and consequently an unlocked SI joint. So the pelvis now is an unstable structure and it can't transfer load properly. The second one is when the pelvis is moving too late, and to achieve complete flexion, trunk flexion, from somewhere else, that flexion needs to come. Normally it comes from movement of pelvis and the lumbar spine together and lengthening of the muscle attaching to those structure. But if the pelvis is locked because perhaps the hamstring or the glute max are very tight, now once you get past that 50 degrees, that flexion is going to come from the lumbar spine and the muscle that are going from the pelvis all the way up to the trunk. Those muscles, they get stretched out and they get weakened over time. And same is for the ligamentous system. Although the ligamentous system or the ligament that are going from the pelvis to the spine and in between each vertebra, they don't have strength, but they do get stretched, and consequently that creating stability of the lumbar spine and the pelvis over time.